Good morning.
How you doing, bud?
I'm doing great. How are you?
I'm good. Are you doing more like rolling? You look like a fucking fighter now.
Yeah, I've been training jujitsu for like 2 years now.
Yeah, now you really look the part a lot more than last time I saw you. You look like you're get into it. That's cool.
Well, a couple of years ago, I think I don't know if you know my story, but like 10 years ago, I had my kidney transplant, and
Yeah.
actually, I'm gonna put on my glasses. 10 years ago, I had my kidney transplant, and the docs were basically like, "Yeah, you should be happy you got your transplant. Take your meds and go play golf and live a happy life. And you try to be a good patient and you listen to that, right? And so 3 years ago, my oldest kid started training jujitsu,
Yeah.
and it was one of those I wanted to do it, but it was one of those, they're like, well, it's too risky, it's too dangerous, whatever. And so finally, one day I had the realization that I don't think these people really know whether or not it's a safe thing to do because one of my doctors came in one day. It was just, he waddled in. He's like 80 pounds overweight, and he's like, "Yeah, just." And so it was one of those things where I said, um, "You know what? I don't necessarily need to have the best doctors anymore, like my primary care, my cardiologist, my nephrologist." But instead, I'm just going to look for those specialists, but who train in real life.
Yeah.
And so they said, well, it's going to take a little bit of work. You're going to have to pass a bunch of tests, but if you do it, you at least go into it knowing what your risks are.
Yeah.
And so that's exactly what I did. And it took me like 3, 4 months because they uncovered a lot of things, which was actually a really good thing. They
This is
uncovered a lot of things,
yeah, yeah.
medically, which
This is like way after you've had the implant and everything.
yeah,
Okay.
yeah,
Yeah, it was kind of like in the PT world, right? Like you can get like one PT who tells you one thing, like avoid all activity that brings you joy, and you're like, exactly, I want to be a good patient. Then you get another PT who maybe has a little bit more nuanced perspective. Is like, okay, well, there's a cost and there's potential, but it's we I don't want to say you can't do anything that brings you joy.
right, right. And so yeah, and and it's obviously funny because I'm a much older um, athlete who goes back and starts jujitsu. I gave up golf to go to jujitsu, right? Like golf was like a competitive placeholder for me, but once I got the green light to do jujitsu, I'm like, oh, I'm doing this, right?
Yeah,
It's way more stimulating for me.
yeah, it's like direct. Where I hate golf. I'm so disconnected. You got the swing, you got the ball, you got the whole jiu-jitsu. It's like right there. That kinesthetic like awareness and feel is like immediate.
Well, golf is okay. I get it. I get why people enjoy it. But at the same time, if given a choice, I'd rather train jujitsu more on the regular, right?
Yeah.
Every once in a while I'll still go play golf, but it's nice to be outdoors and bullshit with your friends for a few hours, but um, there's something to be said about the friends you make at jujitsu because everybody knows, right? Like there are no free passes in jujitsu.
No ego.
Yeah, there's no ego, there's no free passes. Um, and like I don't think anybody goes into jujitsu. I don't think anybody goes a year into it without like having any form of ego completely smashed,
Yeah, exactly.
right?
Yeah, no one goes in thinking like I'm just gonna fuck this whole crew up right away. Like you kind of have to know, like, okay, it's gonna be a lot of being humbled for a long time.
Oh yeah, yeah, yeah. So that's and to be honest, for the last 2 years, my main priority from a longevity standpoint and a health standpoint has actually been cardio.
Yeah. Is this
Um,
like zone two kind of cardio or what?
zone two cardio for the longevity thing, but I also I would do intervals, those horrible type of programming just to help with my jujitsu. And really, in all honesty, I haven't trained any sort of like formal lifting, um, besides just, you know, throwing and grappling and tussling with another dude.
That's you'll train it for your sport.
Yeah.
Like, for everybody who doesn't know, this is Dr. Loke. Normally I go into like a big backstory and do all that, but since I don't have you that long, and we kind of know each other, I'll skip all that. But look, you're kind of the main guy I go to when I refer people to like PRI, whenever I get like shit for PRI, because I feel like for whatever reason, recently especially, I feel like a lot of people have been like painting like a bad picture. And there's always good and bad practitioners for anything, of course. But have you been seeing like a lot of like PRI hate lately? Oh, I saw you. Yeah, you got tagged in one thing from our PT buddy. But what do you think is like where's it stemming from, and like what do you think is the root cause of it?
Where it comes from, I don't know. Um, but at the same time, I wouldn't be surprised to find out that a lot of these people who might not have a favorable take on it might not have taken as many courses as I think they need. Simply put, you can't, like, number one, PRI is not easy, and number two, there's no other way of doing it, right? Like you take any one of their primary course material, which is primary, like their basics. It's a 2-day course. And I could argue that if you really wanted to deep dive into it, you could take any one of those courses and turn them into material for an entire semester of PT school. I mean, that's how deep the material is. But PRI is in the business of continuing education. And so the format by which they're constrained to teach their material is, hey, you have working professionals that can only afford 2 days away from their families to go and take a course, right? If they laid it out as it really was, they're like, hey, this is a 14-week course, right? Where you're going to come to class 5 days a week, 4 days a week, and it's going to be an hour at a time. No one's going to take that course,
Yeah.
right? So you unfortunately have to go in, you get your head kicked in for 2 hours or 2 days, right? You're drinking out of the fire hose, and then on Monday, good luck trying to make sense of the material,
Yeah.
right? That you just got crammed into your head over the weekend. And because of that, obviously you're not going to be as successful as you would like to be, just because you don't know the whole puzzle, right? And so there are other educational groups out there who've taken the concepts and they've tried watering it down or simplifying it, and that's all fine and dandy, but you just can't do that with the level that the institute is trying to teach it at, right? And so, I don't know. I don't know why the hate. Obviously, there's a lot of times where there's a lot of protective mechanisms involved, egos. I was actually at a cadaver lab this past week down in San Diego, and and I met a really cool guy. We were talking, and he was like, "Oh, you're a PRC." He's like, "I've taken a few PRI courses," and he's like, and I saw the what did he call it? He said, "I saw the dining table trick, right, of the popsicle stick in your mouth," and I
Oh
was like,
yeah.
"Okay, well," and so I basically told him I was like, "Well." Like I was like, have you taken the occlusal course? And he's like, no. I'm like, okay, so you saw something at a very superficial level, but didn't really understand what was going on behind it. And so, I spent 20 minutes kind of showing him what was going on. And afterwards he was like, oh, and he's like, yeah, I would have never have appreciated that without you having explained it. I'm like, yeah, well, like you understand that by the time you get to the course where you theoretically could take a tongue depressor to change someone's testing, that's that's some pretty advanced stuff, right? You can't whittle it down and call it, oh, it's a popsicle stick, right? Or it doesn't work that way.
Yeah. Is there anything that like so PR is like your main system that you're using? Like, is that your thought process typically when you're in the clinic?
At this point, it is about 95% of what I look at. Obviously, if someone comes to me and they have a torn ACL, then,
Yeah.
well, PRI is not going to fix a torn ACL or a broken bone,
Yeah.
right?
It could
You
help
need to
you
go
think
through,
about the compensations that they'll have and stuff like that.
of course.
But yeah, the acute phase, yeah, it's not going to do that
Yeah,
much.
go to ortho, right?
Yeah, exactly. And
Yeah.
so one thing that I like I so PRI was kind of my initial framework for this whole like movement model, and I really liked it. I did the three primaries and cervical, and then I started really getting into kind of like Bill Hartman's model a lot. You do any of his stuff at all?
Um, I haven't taken his courses directly, but I've seen a few people who've seen him, and he has his own note-taking system, charting system, right? It's kind of like a little checklist.
Yeah,
So I've seen a handful of those, and
and he was associated with PRI in the early phases, right? Like he was a part of it back in the day.
uh, as I understand it, yes, his time with PRI was way before I ever took my
Yeah,
first PRI course. So for me, anything that has happened between those two parties was before my time, and any information I might hear would be secondhand. So
yeah.
at this point in my life, dude, I'm too busy. I don't go digging into, you know,
Yeah, no,
these
I'm
things.
not trying to be. What I'm thinking is like the PRI, the way, like you said, it is systematic. They do give you like kind of steps to follow because they got to, like you said, give you so much information in such a short time. And you're right. Like that on Monday, you're just like, I can't spit out one thing that I just heard. You got to like sit back. And then honestly, it's really good if you did the in person to just get the home study like the next month and just run through all that. But like one thing from like when I switched to like going into Bill's model, and I still apply a lot of PRI. I use the terms all the time, but I don't think I could have grasped like much of the concepts at all if I didn't have a PRI background because it's just like fucking right there. There's not like a systematic flow. There's not like a way to really get into it, like and understand it right from the beginning. So I feel like that was like super helpful because I wouldn't have been able to understand a lot of those concepts at all. Now, is there anything that you do that is like anti-PRI, anything that you do that is like a little bit different from what they would typically recommend?
I don't think so. If I may, I'd like to say that training jujitsu has really helped my mental model in terms of problem solving and how I look at things, and being able to apply it clinically. But let me say this. I've taken, I think, well over 50 PRI courses at this point, and I can't tell you how many thousands of emails, texts, and supplemental educational stuff I've gone through. And the parallel that I will say is that, in BJJ, you're trying to solve a very fast-moving real-time problem. And and when you can't solve it, you basically tap, right? And the thing is that anytime you get hit with a move in jiu-jitsu, it's not that it's an unstoppable move, it's that you don't know the counter yet,
Yeah.
right? And so in that light, I would say PRI has provided almost all the answers I've looked for um, with my clinical population and the things that present in front of me. Uh, and the times where I wasn't able to completely resolve someone's issues was because I didn't understand that section of the PRI model or this concept. I didn't understand it well enough yet. So, for example, in the PRI primary course, the postural respiration course,
Which I tell
there
people that's probably if they're in like a bodybuilding world, I usually tell them that's because I ask all the time, which to start with. I usually tell them that or myokin, but the postural respiration because it involves the upper body stuff as well as the lower body, the rib
oh,
cage.
absolutely. And so, in the postural respiration course, there is a right low trap, right triceps program. Okay. I've taken that course 5 times now. Okay. And even to this day, I'm almost 10 years into studying PRI. Every single week, there is a new revelation about that program alone. I was like, oh, I didn't think of it that way. Or, oh, okay, that's feed forward to get the left side of the upper body moving better. Oh, okay, right. So it's one of those things where um, no one is going to get it, right? Taking respiration the first time. And so once again, it's like this is how deep it is where I continue to take it. And by taking it from other instructors, they might say something that registers or hits me a little differently. But at the same time, I also might be in a different position to accept or receive that information, right? Like to have a right low trap, right triceps program conversation with me today versus having that conversation with me 2 years ago versus 4 years ago versus 6 years ago, right? It's all they would be all much different conversations, right? Like same thing in jujitsu. The conversation around any submission or any tactic, right? When you discuss it at white belt, at blue belt, at purple belt, at brown belt, right? There's so many times where, you talk to a high level guy who's a black belt and they're like, "Oh yeah, I didn't learn this till purple belt. I wish I learned it at white belt, and it's made my life so much easier." So there's a lot of that in terms of parallels.
Yeah. Yeah, the
Yeah.
nuances. The nuances make like everything. And that's something you do pretty good as well as like on your Instagram. I like how you kind of break that down. And so with most of the people that watch my stuff, it's more like trainers and people with like aesthetic goals. And I have a lot of people that are into like the PRI and the Bill Hartman kind of model. And I think it's obviously easy to see why the PRI model is great for rehab. I mean, you can, especially when it comes, which I want to talk about in a second, when it comes to people with chronic issues, I feel like it's amazing, right? Because so many of those are positional issues that we can address with PRI, but it's also really easy to kind of see the link to performance. I feel like the performance link and rehab link is pretty close together, but I don't feel like there's been like a huge connection made to the ability to actually like put on muscle and your aesthetics while you're doing it. Can you speak on that perhaps on ways that you think like if you fall into like a pec pattern or if you were like really hard into like an AIC, how certain presentations could maybe prevent you from looking your best aesthetically or even like putting on muscle where you want to?
Yeah, no, that's a fun question. I've actually worked with three different bodybuilders who reached out to me and were interested in trying to figure out, oh, I can't develop this muscle, so on and so on and so forth. And so, um, what someone does before they get into the world of bodybuilding, probably heavily influences how their bodybuilding career or hobby goes, right? In terms of being able to put muscle and develop muscle where they want it to be developed. And so that's always something you have to take into consideration with the person, right? Like, okay, in a in a former life, they were a power lifter. Okay, so now they've gone from lifting really heavy weights to lifting a lot of weights with a ton of volume, right, for the purposes of packing on muscle. Okay, cool. That's going to be one type of base presentation, one type of foundation that you're going to work with, right? On the other hand, you get someone who, let's just say they were a track and field athlete, and for whatever reason, after their track and field career was over, they decided to go into bodybuilding, right? That's going to be a completely different foundation from which to build on. And then we talked about this before we started recording. Let's say you get someone who is a golfer, right? A very one-sided turn from right to left, right? Activity. And let's say they decide, okay, now I want to go into the sport of developing my body for aesthetic purposes, right? They're all going to have different ways that they connect with their body, and they're all going to have different ways that they're going to live, i.e., breathe and walk inside and outside of the gym, right? And so, depending on what they've had going on in the past, including injuries and or compensations, they might find no problem putting on muscle anywhere they want. And other times they'll be like, I mean, the biggest one that I saw with all three of those was like it was very easy for all three of them to find and develop. I mean, they had really big right lats,
Yeah.
but they couldn't get their left lat to grow as big and as wide and as pretty, if you will, right? As defined and cut up as the other side, right? So
Do you find that
that,
sometimes they have trouble presenting their right lat compared to their left, even though, because I see like from the back that thickness, but a lot of times from the front, sometimes they're so closed down and that lat's, it needs to be inhibited. Sometimes it just doesn't open when they present, even though it's like looking so meaty and thick from the back.
yeah, so that's obviously a great observation on your part, which speaks to what we see in the front side of that rib cage on the right on most people. And so if we can go back to someone in history, um, I think one of the most aesthetically pleasing bodybuilders from back in the day was a guy named Flex Wheeler,
Oh yeah.
right? And I mean, how well could he express his ability to move his body?
Yeah. You can do the splits and that
Right?
full rotation. I mean, he was the Sultan of Symmetry.
How he didn't win more titles, I don't know, but at the same time, he was also, he was in an era of some other really like greats, right? Like he was in the time of Lee Haney, Dorian Yates, right? In that
Ronnie.
time period,
Yeah.
right? Ronnie Coleman, right? I mean, Ronnie Coleman, I mean, I'm now seeing these interviews that they do with this guy. I mean, that guy is missing a few screws, but that's what you need,
Yeah.
right?
Oh yeah.
To achieve the greatness that he has. I mean, Ronnie Coleman is like I think like he's basically the bionic man at this point. Like everything in
Yeah.
his body is in
Poor guy.
place,
Yeah.
right? But his mindset is still there, right? He has no regrets and he still wants to lift through all his joint replacements. That's just it's so ingrained in who he is, right?
Yeah.
And that speaks to what it takes to be a complete outlier in whatever activity it is you choose to do.
Yeah,
So yeah.
definitely. So we
Yeah.
got the right lat. What is there any other presentations you notice?
Um, I mean, the biggest one, the other one was biceps, triceps, right? Um,
Do you see the asymmetrical triceps where the left will look, a lot fuller and like all nice and the right's kind of wonky?
yeah, yeah, yeah. So that's something that one of them reached out to me for. Um, and then I think I don't know this to be true. I'm not that deep into the bodybuilding world, but the big thing that they all seem to be concerned with was their calf size.
Really? I'm so like I've never trained calves like a day in my life. I just got good calves. People get so fucking mad.
Yeah, calves is a very appears to be a very polarizing topic in that world, right? There are some people who just have it, and there are other people who don't. I know. I remember reading the stories of Arnold Schwarzenegger back in the day, like going to the gym and covering up his entire body except exposing his calves because he thought they were, puny and pathetic, and he wanted to highlight them so that he could, completely obliterate them at every training session.
Yeah, he did grow them too. You can see, like, he used to do them like at one point he would do them between every exercise. It'd be like a chest day. He's like, okay, here's my rest. I'm gonna do a set of calves.
Right. And that's what it takes.
And so, for somebody who's like more pec pattern, and I use that term on my channel a lot. People know like pec pattern and at least left AIC. What might be something different you would see for someone who's in a really let's talk about the power lifter who started bodybuilding. They might have like a different presentation as far as like not able to get like a 3D look on certain areas. Like I tend to see them not get as much like of the really round like bubbly muscle and the lats that really don't flare. Is that just because they're stuck in such an extension pattern? They're putting like so much
Yeah.
back.
Yeah. And those people you're going to see, they're going to have very well developed um, lumbar extensor muscles,
Oh yeah,
right? And
adductors usually.
yeah, and these are going to be the people who it looks like they have a harder time developing that meat in between the shoulder blades,
Yeah,
just because that meat in between the shoulder blades only lives with the shoulder blades kissing each other,
yeah,
right? So, you have any muscle live in short all day long, and it's not gonna in the sport of bodybuilding, it's not gonna grow to the potential that it should, right?
yeah. And it's not, and even if you did have it, you won't be able to present it very well either.
Right, right. It's hidden in your posture.
Yeah, exactly. And something I talk about that PR really helped me with was taking some of the concepts we would use for positional drills and then thinking about them like in the weight room and just being aware of what maybe your specific compensations are. So it's like obviously for a pec pattern, an easy one to think of is don't default to extension right away. You know, keep a little bit of your ribs down, a little rib control. For someone who's like me, who was in a pretty bad like right lateralized kind of situation, like I'm like my what I got to think of anytime I'm doing legs is don't shift hard into that right side. Like get a little shift into the left if I'm doing a single leg thing. Like make sure that I'm not pushing out of it. It wants to ER, right? Are there any other like concepts that you can use to like think of as far as like in the gym that you won't play into your imbalances? And it's usually right when you're getting really fatigued, right? It's kind of easy that you don't even have to think about it the first few reps, but as you get fatigued and you're getting closer towards your failure, that's when your body's going to want to kind of go in towards this compensatory mechanisms.
Um, I mean, I didn't work with any of those bodybuilders long enough, but I'm just thinking out loud right now. I think for most bodybuilders, the number one thing you're probably going to want to train extra hard is going to be the ability to use your serratus anteriors to keep your rib cage back relative to your shoulder blades. Uh, as you develop your back extensors, right, and as your shoulder blades live in a posterior orientation as opposed to, if we think of the rule of three, we have a middle, we have one direction, and we have the other direction. So for the shoulder blade, we've got something that's in the middle, we've got something that's closer to the spine in the back, and we've got something closer to the pec in the front, like a scapular protraction, right, as opposed to scapular retraction. So if you can train your serratuses to keep your scapula, your shoulder blades forward, that's going to allow everything in that upper quadrant, your pecs, your lats, your delts, biceps, triceps, all those things to work a little differently. And I think you'll find that the ability to push things overhead, incline, straight bench, those things are going to feel a little more powerful. And you're going to be able to develop more muscle because as you get into this really extended pattern and your pecs are at length, while your the intrascapular, the things in between your shoulder blades are short, it's going to be really hard to ask your shoulders to be in a good place to push all that weight. And now all of a sudden you've got shoulder problems, right? And you kind of have to do whatever it takes to push that weight off the rack and get it up overhead and get all your lifts in.
Something I talk about a lot is pressing mechanics because, like you said, a lot of people do just compress and they just stay squeezed back, and that can allow them to use like more weight. But like you're saying, the power that's not really coming from the pecs anymore. They're not able to get any kind of like protraction force. A lot of times they don't have any like depression of the shoulder girdle, which the pecs are gonna help with too. So that's like one of the big things I talk about is trying to change the way people press, not to. I mean, and there could be an application for anything, but it's when you live there and that's all you do. But that's one of the big things I preach on my channels. What I'm like most known for is pressing with a little bit more of like a stacked rib cage position and actually not getting that dorsal like the squeeze in the back. Because like you talked about, you will get a really big stretch on certain like distal fibers, but when we lose the rib cage, we're actually losing the stretch on like a vast majority of the sternal fibers, right? So now we're missing all those guys. They're not really coming to the party. So that's another muscle group that I see a huge like difference on like a power lifter who has to do that to hit certain depth versus somebody who trains more like an old school bodybuilder with more flat back. They tend to have just way more details in the pecs. And I think that's because they're getting way more from the sternal fibers, especially.
Right, right.
Yeah.
Yeah, no, it's a lot of fun as you might be able to tell, like this is not the world that I live in. Obviously, I live in the world of helping people with a lot of big issues. So it's fun having this mental exercise of exploring what could be going on out there.
Yeah, yeah, and exactly. And like I said, I there's such a link between the performance and rehab, I feel like, but the actual like just aesthetic side of things, not so much. And then I guess one other thing that I see a lot is like we can talk about like rotation, right? Like I'll see people maybe rowing with like their left or they're doing unilateral and that rib cage already wants to kind of like ER and they might get like a little trunk rotation on that side, whereas the right they might not really be getting that much, and so I'll either have them not go on the left, or maybe if I do want them to open a little more on the right, just try to make sure it's coming from like the right stuff instead of just turning as a unit. Can you speak on like the right turn and why that's such a big move in PRI?
So, right trunk rotation is a very powerful concept in PRI because effectively um, we are anchored on our right side. And from this anchored right ab wall that then eccentrically holds on as we turn into left trunk rotation, that's a default pattern that we're pretty good at. Okay. But what you'll see with most people is that because of the base pattern, which is pelvis turned right, trunk follows along, trunk is trying to counter rotate to the left, right? That's what you're seeing. Um, what people have a real hard time with is getting onto their left side, anchoring here, and eccentrically hanging onto the abs as you counter rotate to the right. And so there are plenty of ways to turn your trunk to the right. Uh, you could use a neck, right? You could use a lat. You can use other things. And so as you become more patterned in a not so ideal manner, um, that comes at a cost with your everyday life outside of the gym, right? So, when you're a bodybuilder, that's great. I want everybody out there to do what they love and they enjoy. That's what life's all about, right? Doing the things that fulfill you. But as humans, we have to ultimately just get from point A to point B, right? We have to move around in space, right? And when your hobby or your profession affects your ability to locomote, right, without pain and pathology and things of that sort, now we have a problem, right? And so that's where making sure that you can trunk rotate to the right legally will save you down the road for when your bodybuilding days are over, right? Or even as you're trying to make it
Yeah.
through, right? Because yeah, because all three of those bodybuilders that I worked with, I wouldn't say any of them had any sort of like real pain presentation. They just had issues with, oh, I can't really develop this muscle. That's why I'm hiring you. But on the other hand, when I think about like the power lifters that I work with, I mean, those people are walking injuries, right? Just because
Yeah, there's no movement
they're,
variability.
well, there's no movement variability, but they're pushing their bodies to the absolute limit with lots and lots of weight. I mean, it's no different than if you were a race car and you just ran it
Yeah.
in the red all day long, right?
Yeah.
Stuff's gonna break.
Yeah, and the right trunk rotation it plays into like so many things. Like you could be dealing with some bicep tendonitis and stuff, and then like that could be
100%.
that could be a big role in it, and that goes into the whole positional issues thing. Maybe we could speak on that real quick. So what really made me like love PRI when I first got into it was I had left like IT band pain, left leg IT band pretty much my whole life after I had an injury. And like you said before, the activities you do before you start bodybuilding play a huge role. I was a right wing soccer player. I played that for 12, 13 years. So I was really playing into the left AIC patterns. I just couldn't run. I also had an injury and I couldn't get any kind of impact without having pain. I could squat, I could load and do things like that, usually with no problem. As soon as I took my first Myokin course, which was the first course I took, and I got a little bit of a hip shift and I drove a little bit of IR on that left side, I could all of a sudden do this thing that had been limited me for 16 years, 17 years that I just had never been able to do consistently. And now if I do like a left post-capsule inhibition, if I need to, like that's all it takes. And I can go run for an hour and not have the same pain that I used to have. I mean, for you, you're probably dealing with like pretty complex cases, but do you still get cases where somebody has like a positional issue that you just so happen to recognize and are able to solve and give them like a lot of relief right away? Are there any other examples you can think of like that?
Yeah, at this point in my career, I do track. It's kind of fun. For the people who don't know, at the level of the pelvis, the diaphragm, and below, between the pelvis restoration and myokinematic restoration courses, there are basically three oversimplified categorizations of presentation. So you have the left AIC, which is what everybody comes from the factory with, if you will. a PEC pattern, and then you have a pathological PEC pattern. So basically 99% of what I see now are the latter two.
Yeah.
Okay. People who are just patterned up the wazoo for whatever reason. So if and when I do get someone who comes in and sees me and they just have a left AIC pattern, for me, it's like playing with house money just
Yeah.
because it's so easy for me to clear these people up.
Right.
And so for those people, I actually have fun and it lets me experiment with because I can get those people like better really, really quickly. And so those are the people that I know I'm not going to hurt them. So
Yeah.
it's one of those like, okay, what else? Let me try some techniques maybe that I don't use all the time. Right. So to answer your question, for the people like I want to say every year I see less than 10 people who are just lefty ICs. And half of those people usually come to me just because they're more curious about what PRI can do for them as opposed to like, oh, I have an actual issue, right?
Yeah.
Or at this point, I also have worked with so many people that, I'll get someone who says, oh, I'm going to bring my daughter in, or oh, I'm going to bring my husband in, and I want you to take a look at them because they're going into this, and I don't want them to, come back, go into it too far without developing a bunch of problems.
Yeah.
So I'll just see him for a visit or two and just be like, okay, cool, work on this and go do your thing. And if you have any problems, I'm here for you.
Yeah, that's always the coolest is like when you get somebody who's hasn't been able to do a certain workout, like a certain movement for like ever because of an injury. And then once you get them positioned in a way where they have space to move and they're like, holy shit. And as a trainer, like, or a therapist, so obviously that, especially after a trainer, that's what builds your value like immensely versus other trainers who are just like, workout programmers.
100%.
Now, for you, like you said, you get these pretty complex cases. Speaking of, I have a girl I got to send you. I'll keep telling you about her. You good with like recording while you're there? I can't
Yeah,
drive.
yeah,
I
I'm
can't drive
fine.
to LA. I'd rather drive through the
Yeah,
gates of hell. Okay. Okay, cool. So you get these pretty complex cases. I'm assuming they've seen other therapists, a lot of times, probably even other PRI therapists. And so it's probably pretty unique each time. But is there any kind of like overarching or any kind of theme with these unique presentations? Is there one or two or three things that tend to be what makes them complex? Is there something that's keeping them from sticking, or is it every single one just so unique? I know you just spoke about ankles. That might be something.
yeah. There's no really one overarching theme. I think if anybody's curious, I think the key to my success is just the fact that I've been doing this for so long now. I'm in my 23rd year of practice. And after 23 years, before, during, and even after PRI, um, the key is always listening to the person and hearing their story, right? And
Real quick, I think that's actually huge from a PRI therapist because I do think that's one of the like weak points that people point out on PRI. And again, it's dependent on the therapy, but I feel like some therapists do like not take into account what the patients are saying.
yeah, no, I mean, the people who come see me for the first time, most of them are pretty shocked at how long my actual initial paperwork is, my intake form. Like I've got a lot of questions on there, and not a single one of them is pointless. I go to doctors' offices myself, and I'm like, okay, why are they really asking this? Like, is there any point to this? But every single question that I ask on my intake form, it's all there for a reason. And so, for these longer, more complicated type cases, I might not put hands on them until we're 45 minutes into the session. So as soon as I can figure out, who they are and why they're presenting to me, the physical body part, the physical testing part, that's easy, right? It's really what's making them tick. What are they missing? What do they need from me?
Do you see a lot of like what do they call it? The BPS? What is that? The biological, psychological?
Biopsychosocial model.
Yeah.
Uh, I don't I don't really subscribe to that school of thought. Because their way of intervening would be a lot different than what I do. Because um, ultimately, I'm going to go into my PRI toolbox to help you, right?
Yeah.
But I think it's what is done before I open up that toolbox that I think has been a part of my success. And so, and plus, like I said, I go through courses with very specific intention. So, the first time you take a PRI course, you're just, as they typically say, drinking from the fire hose. Okay. So then you go back and you have a few months, maybe a few years of clinical experience of like, okay, I've tried this and I don't understand this part of whatever, this material. Uh, so for me, the big course for me was the impingement and instability course. I've taken that 5 times, and every single time I've taken it, I've gone in with very specific intentions. Okay, I want to know why this section is written the way it is. Why is this material organized the way it is? And so when I go back in, because I personally don't have the mental bandwidth to be completely focused for 8 hours at a time, 2 days in a row, right? So for me, like I'll go into a seminar and, I can keep my attention span low, right? And then as soon as we get to something that I don't understand, okay, now my attention can be higher. I can't have high attention for 2 hours straight before the next break. That's just not who I am.
Yeah, that's not who a lot of people are. I mean, maybe pop some Adderall or something. I don't know. That's not natural for me
Right. 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 So I pick and choose my spots.
either. Yeah. Do you go into like sensory shifting at all? Is that something that you like apply and do at all?
What was that?
Sensory shifting, is that something that you mess with and apply to your
Yeah, yeah, yeah. So sensory shifts. There's a catalog of 5 different sensory shift activities in the PRI cranial resolution course. Um, they actually have a very, very specific intent. And I mean, let's put it this way. If I'm having to pull out the sensory shift activities with you, then you need a lot of help. Uh,
Yeah.
yeah.
Is there one thing that tends to like kind of keeps changes from sticking more than others, whether it's like the foot, maybe the jaw or their eyes, at least with the people that you see?
Um, the more complex the visual history is, obviously that's going to take a lot more work because um, I I'm not an optometrist and I'm not a neuro optometrist, so I have an idea, a general idea as to what we're trying to do. But when people have actual pathology and a history that makes the optometrist say, "Oh, we have an issue here." I mean, there's no way I'm going to fix it, right? And
Yeah.
so now it comes down to, okay, how does their presentation from the visual standpoint manifest on the physical side that I'm trying to work on, and what is this optometrist trying to do? And ultimately, between the two of us, we're trying to see how two and two, uh, what it equals clinically, right? Because it doesn't always, it's not always two and two equals four,
Yeah.
right?
Interesting. So before I let you go, maybe we can give a couple practical things for some people to try. So something you see is you probably see way more presentations than I see because not everybody produces force, especially in the gym. Like I just see people who work out, and usually they work
Right.
out like powerlifters. So there's gonna be less variations with that, obviously. But so let's say we're talking about just the pec pattern bodybuilder, which I mean everyone's gonna fall into a pec pattern, which that's probably
Right.
the one thing I do a little different than PRI is like if you fall into a pec pattern and you're really like a narrow like archetype, like I'm probably gonna try to turn you a little sooner than what maybe I would do in PRI if I was following that exactly. But for someone who's like like a real bad pec pattern, just stiffness everywhere, what is like a really bang for your buck move? Do you recommend those are the kind of people that do some balloon work, or is there something else you would like?
Um, so we're talking about the bodybuilder population here.
Yeah.
Okay. So generally speaking, for bodybuilders, what I would say is that you guys are going to want to recover, right? Because there's no doubt that you guys put in the work when it's time to go to the gym, right? And so it's a real tragedy that all that work that you put in the gym maybe doesn't get the amount of proper recovery that it deserves. And so maybe not so much sure, a little bit before the gym, right? But when it's workout time, it's go time. That's the time for you to turn into the Hulk and lift all the weight, right? And blast your music and, get every single little ounce of out of juice out of your body. That's all fine. Okay. But when it's time for you to go from the Hulk back to Bruce Banner is the guy who can recover at night and can grow muscles. Hulk is going to do the work. Bruce Banner needs to recover, right? So the sooner you can get into recovery mode after your workout, the I think you'll get a lot better gains as part of your everyday practice. This is where it compounds, right? And so, I mean, a real easy one that anybody could do would be um, on a Smith machine. They can do a basically a bar supported, like you're hanging onto the bar, and you're going to squat down into like a little curled up position,
This is oh,
right?
you mean like a squat and reach, the low one?
Yeah. Yeah,
Yeah.
little squatting reach. Stay in your heels, keep your knees together, and just try to get to a deep exhale. Try to keep your front side closed off. You will positionally close yourself off, but if you exhale, that will muscularly keep you closed off. You then go ahead and take some easy breaths in, and you'll expand your back, basically, for all intents and purposes. That will dial down your nervous system, and that will let you recover. So if you can do that at the end of every workout and just use it as a place, if you have your headphones on, put on some relaxing music. It's time to chill, right? You've gotten everything, and afterwards, it's time for you to go and eat your, 50 grams of protein and a gallon of water and all those kinds of things. Then I think you get into that type of routine, and magically, it will pay off more than anything else I could tell you.
Yeah. And from like a PRI perspective, if you are like a pec pattern, the goal is to find your right side and kind of get into a left AIC pattern and then get out of that, correct?
No, if you're a PEC, we would just want you to be less extended.
Yeah, but usually
If
that'll push you towards a left IC, right? Once you get rid of those outer layers, you
Yeah,
might.
yeah, yeah, yeah. So as you peel away that layer of PEC, you don't have to try to get into a left AIC. As soon as you remove the PEC,
You'll
you'll
just
be in a
fall in
left.
there. Yeah. Okay, cool.
Okay, but basically, once again, going to what I just said, it's going to be much easier to recover, to grow your muscles if you're sleeping and resting with proper full diaphragmatic breaths.
Yes, that's huge. I don't think many bodybuilders take one single like, good breath a day. You know?
Yeah, and I mean, once again, a lot of them, both in the powerlifting and bodybuilding world, a decent number of them are on CPAPs, on
Yeah.
some sort of device to breathe, right? Which that's obviously if you're a young, healthy person who's lifting a lot of weights, um, by doing this healthy activity to the point where now you need assistance in breathing, uh, maybe there's something missing from your program.
I mean, I was on a CPAP before I did any breathing work, and my weight is the same, and I'm off of it. It dialed itself down. It's one of those automated ones. It's like you don't need me anymore. I'm not even working. So there's definitely something to be said about that. Man, thank you so much. I really appreciate it. I know your time is really valuable. Maybe in the future we get together one more time. Thanks a lot. Are you doing anything out there right now? I know you do a lot for the trainers. Do you have any kind of like mentorship or online stuff that you're doing?
Yeah, so I have a couple of things. I teach a manual therapy seminar for knees, feet, and ankles. I'm teaching again this upcoming weekend. I do have an online learning platform. It's really I'm not teaching anybody PRI, but instead my online platform are case studies where I just go through case studies and I just show my thought process, and it's a forum and people are able to post questions. And I basically run it as if any of the subscribers were my interns back when I took interns from PT school. I would talk to them about, professional expectations. Obviously, we're going to do a lot of clinical work, but then also there are a few people out there who are interested in like the business side of things. Like, hey, how do I grow my practice? How do I get referrals? Things of that sort. And so I talk about all those things. It's an online platform. And yeah, those are the things that I offer outside of my everyday clinical work.
So just through your Instagram, you can find that.
Yes, you go to my Instagram, Dr. Locrao, LODRLOCRAO. That's my Instagram. And you just click on the link tree bio in my bio, and you'll be able to see what I do and what I offer.
Awesome. Thanks a lot, brother. If you end up down here at all, let me know. I have a person or two that I'm sure I could send you if you're going to be in Orange County anytime. I know you don't come down here that much, but let me know.
Ah man, I stopped through Orange County yesterday, and as I was driving back to LA, I was like, why am I not in Orange County? Why am I not in San Diego?
Right. Exactly. Exactly. All right. Appreciate it, brother. Have a good one.
All right, take care.